Thank you, listeners, for joining us. Our weekday program featuring community news and local issues. Today's special guest has come from out of town to talk to us about very important issues revolving around our veterans. This is a group, Concerned Veterans for America. Ryan Gerchman is the engagement director for this organization. And Ryan, thanks for taking some time and coming to visit with us here in studio today.
Absolutely, Lori. Thanks for having me.
Absolutely. We know you were in town for a special event, right?
Yeah, the Elko Veterans Corps is an amazing group that really brings the veteran community and veteran family community together. Yesterday, they had a game day event with amazing food, amazing people. Everyone got together, rooted for their team. There was some little raffle prizes, and it was so fulfilling. And seriously, I say that I ate way too much. And it was just a great time. I'd love to thank Elko Veterans Corps and Danny for hosting us all.
Very nice. Well, absolutely. Anytime, Ryan. And sounds like you'll be back because you had so much fun.
Absolutely. Every time I come to Elko, it's a great time.
Awesome. So let's talk about what the Concerned Veterans for America is. Is this a nonprofit organization? Tell us about how you're structured.
We are. So we have 11 chapters or 11 states, so we have 11 chapters, and this year we want to expand even more. Each of those states, right, we in Nevada, I'm in Northern Nevada, the Grassroots Engagement Director for the North, and then we have our state strategic and our Southern Nevada Grassroots Engagement Director out of Las Vegas. And so between the two of us, the three of us, we cover the whole state. And what we do is we advocate for empowered people-driven solutions from the ground up, right? Our solutions are rooted in liberty-based principles. We're a principle and value-based organization, and we will unite with anyone to do right. We're nonpartisan, so it's important, right, to work with both sides of the aisle in order to advance those programs, those policies that are not just good for veterans, but are good for all Americans. And we really pride ourselves on being able to work with everyone to advance principle-based policy.
Ryan, thanks for the explanation. Of course, as you mentioned, when you can lift one boat, usually the goal is that all boats will rise. And so
100%, right? Like I like to say, a healthy veteran is good for the community because that veteran can give back to that community, right? We're natural leaders of the discipline and the training that we've had. And so when we're healthy and able to strive forward, right? Like you said, lift the boat.
So there are several pieces of legislation that we know on the federal level that the Concerned Veterans for America is working on, as well as we're going to dive into a little bit what may be happening at the Nevada legislative session, Ryan, so that people can bookmark that and lend their support or get more information if they like.
Yeah, absolutely. So statewide, right, we are mainly based at the federal level, Concerned Veterans for America. However, our partner sister organizations, Americans for Prosperity, are based at the state level. Libre, our Hispanic Latino branch, is based at the state level. And they work with local legislators and local assembly, senate at the Capitol in Carson to advance those liberty-rooted policies that are going to rise everyone's boat, as you say. I love that analogy. And so the legislature right here in Nevada, we have the United Veterans Legislative Council, which is huge. It's a conglomerate of the different VSOs, Veteran Service Organizations. You have the VFW, Veterans of Foreign Wars. You have the DAV, Disabled American Veterans. You have the American Legion. You have Women Veterans. I mean, if you're a veteran organization or a veteran advocate, your organization is probably or needs to be tied in to the UVLC because they work directly with NDVS, Nevada Department of Veteran Services, to advance the chosen priorities that veterans in Nevada vote on each legislative cycle, and the UVLC advocates as one voice for all veterans at the legislature to advance those policies. And if you're able to get to Carson City on March 18th, that is Veterans Day at the legislature. And I'm going to look at my calendar to make sure I get that day right, because I don't want people driving all the way down from Elko to Carson. And then, I'm glad I looked, because it is actually March 19th.
That is okay. We'll
Yes.
get the right date.
Yes,
Yep,
ma'am.
March
March
19th.
19th. Yeah,
March
absolutely.
19th.
Absolutely.
And of course, our local lawmakers will be on top of that, I'm sure. But Veterans Day at the Nevada legislative session. And we're talking with Ryan Gerchman. He's the engagement director for this nonprofit organization, which is Concerned Veterans for America at the national level, but obviously expanding outreach here in rural Nevada and rural America. So one of those things that I think you were talking about, bringing veterans together, something that was probably voted and decided as a priority, access to health care, and then having more choice in the type of health care that veterans receive?
100%, right? And so this is where we align with the local level with everyone, right? Is the having the options and the choice and empowering individuals to have the healthcare options and choices that are right for them, right? It's not a one size fits all. And unfortunately, our VA, right, is an administrative bureaucracy, and from the top down, and often the focus of the veteran is lost in the sea of red tape. So what we're really trying to push, excuse me, is the Veterans Access Act, right? This is an extension of the 2018 Mission Act, right? It will expand the community care program, and it will also codify existing policy within the community care program, the Mission Act, that unfortunately the VA is kind of good at maneuvering around. Wait time, codify what is an actual wait time, right? Is it from when the veteran goes in for the first consultation, or when they make the phone call? Or is it, like the VA does sometimes, is, okay, the wait time was this. Oh, wait, we bumped their appointment, so now the wait time gets moved up, and it looks on paper like the wait time is less, when in fact, it's not. So we want those kind of things, VA accountability, to be codified, right? So that it is law, and that the VA has no room to maneuver so that they look better. Now, I like to say all the time, not all VAs are created equal, right? And there are incredible people that work within the VA system. However, there's always that 10% in anything that you do. And there's no reason that 10% should be able to have detrimental impact on any veteran within the VA system. And right now, there's nothing to be done to get rid of these individuals, because it's a government system and it's almost impossible to fire somebody. So that's something that we're working on as well. VA accountability, Veterans Access Act, mental health is huge, a pilot program so that a veteran who's experiencing depression, suicidal ideations, thoughts, right, can go to any healthcare provider to get this assistance that they need before it's too late, without a referral from the VA. Because a referral from the VA, bureaucracy, administration, can take incredibly long. And by that time, it's too late, and we've lost somebody, and that's just unacceptable.
Well, Ryan, thanks for obviously, pointing out some of the biggest concerns that we have in rural America and in our community. Why do you think the VA would be? Why would they oppose community care, as you just described? I mean, what is that underlying concern?
So I know that the prior director of the VA, right, the administrator, right, he wanted the VA to be that central hub and the absolute go-to for veterans. There's this term, noble ideals, right? And noble ideals it sounds great, but in reality, that's not the way it works, right? The VA wants to turn veterans back into the VA system, right? Because at the end of the day, that's more money that they get, right? And there may be good intentions with that. However, the fact of the matter is if it's not a choice, if there's not an option for that veteran, then is it really the best thing for them, right? Like, if it's like it's like food, right? Like if you have this food or this food, and one's like not healthy for you, and this one's not healthy for you, but maybe that's because I'm gluten free or something, but these are my only options, then okay, which one is better, right? And for a lot of veterans, it's the same thing for the VA, right? We look at it and we see it, right? And it's just scary, and we don't want to go in.
So everything you're describing, like the wait times and the type of delivery, not having a choice, it sounds cumbersome. And then we're hearing that about a lot of federal programs, that they're just big and they're weighty, maybe one size fits all.
Yeah.
So in Nevada, would the ideal be that there be a different type of system rather than a federal system, right? I mean, is that what concerned veterans are working for?
So we're mainly working for right now. So the way the community care program works is you need to get a referral from the VA. If a veteran lives 30 minutes or further, or if they have to drive 30 minutes or more, the VA is supposed to refer them out into the community. If the VA does not provide a service, then they are supposed to refer that veteran out into the community. If they have to wait 28 or 25, I believe, days, then the VA is supposed to refer them out into the community. Unfortunately, the former deputy administrator said, let's hit the easy button less on the community care program and drive veterans back into the VA, right? Because they want those veterans to stay in the system, right? They're afraid that they're going to lose their funding. And I mean, I'm not a VA administrator, so I can't speak to their actual fears. However, they don't want that veteran to go out into the community because they feel that it's not the best option for them. But realistically, data states, right, our information states that choice options are less expensive. Community care, there's less bureaucracy, there's less red tape, there's less people in the decision-making process. And for a veteran to go out into the community is less expensive than to stay in the VA.
Well, we know, for example, that we have an Elko clinic and have had for some time, and they're moving into a new space, which is going to be expanded and bigger. But we also understand from our local veterans, they do rely quite a bit on telehealth. So what you're saying is, it would be more advantageous to see a local family practitioner or someone maybe that you're familiar with.
Yeah, absolutely. Like, so if I'm a veteran in Elko, right, then I can go to Salt Lake, right, to the main campus. There's, my understanding, a satellite clinic here somewhere.
There is,
right?
yes.
So those are my options. But like, maybe I'm not the satellite clinic. I don't even know how many doctors it might have, right? But probably not a whole lot, right? Through my private healthcare, through my organization, I'm able to search and see who's taking on new clients, right? And I have some options as to what doctor I want, right? In Reno, my VA doctors, I had 2 options that they gave me, right? And if I don't like those 2 options, I'm tough out of luck, right? We just want community care to run much like Medicaid, Medicare, TRICARE, right? And if you have a list of providers and this is where I can go for my service-connected disability issues, then that's where we want the veteran to be able to go. And if I wake up and I'm like, I'm going to go to the doctor for this and it has nothing to do with my service-connected disability rating, then that's on me, right? We're not asking the VA to just give medical care to a veteran who's not even registered in the VA system, right? That's an important note, right? You have to be in order to be eligible for community care, you still have to be registered in the VA system, right? So here in Reno, I have those 2 doctors. Here in Elko, maybe I want to go to the community care provider, or like that Dr. Bob, right? Instead of the VA or Salt Lake City. That should be my choice.
And that's where we get to this reimbursement issue. So whether or not an individual, a veteran, or family member can be reimbursed, or that care provider, right, Ryan? Because that's where we know some of the frustration comes from, especially from rural providers, is reimbursement.
Absolutely, and so that's the thing, and that's another thing that we're working on is to ensure that that reimbursement process and that payment system is streamlined to standards that are held at the standard across the industry, right? Because that's a fear of private providers is they don't want to get on board because it's government and the VA takes oftentimes forever to pay them back. So that limits it. So let's make sure that that standard is there, right? Again, VA accountability. Do the job that you're supposed to be doing for our veterans.
And so everything that we've been talking about, the Mission Act of 2018, playing into the Veterans Access Act, Ryan, these are already laws, right?
Yes, ma'am.
And
They are.
so we're just kind of spinning our wheels in frustration?
We really are. It's the VA. I don't know why they believe they can do things the way they do necessarily. Maybe because it's their size and the power they wield with veteran care. But again, it's about the veteran, right? It's not about anything but the veteran, right? Veteran first. And we're excited for the new administration. I watched the hearing for the new VA administrator, right? And he said that we want to put the veteran first, right? And I've talked to individuals within the VA, right? And that's what they want to do. But they're oftentimes trapped by their own bureaucracy, which inhibits them from doing what's right for the veteran.
Ryan Gerchman is Engagement Director for Concerned Veterans for America, which is a nonprofit, nonpartisan. So that does bring us to an important point in the program. We can talk about how people can engage and help encourage. This is a grassroots group. As you talked about, I mean, it's no secret the accountability that the federal government, many departments are going through right now. The VA has not been mentioned as being on the list. So
absolutely. And I mean, national defense, one of our policies, one of our priority initiatives is realism and restraint, right? Our national defense system. We need to be a strong nation, and we can't be a strong nation without our warfighters, right? And those warfighters right now are not signing up to be. Enlistment is down across the board. And why do we think that is, right? I think part of it is because of what we go through VA, right? It's this hard for us to be taken care of, right? It's this hard for the nation to deliver on its promises to its veterans, right? It's pride in self, pride in nation, right? These are all self actualization, getting to the American dream, right? All of this comes together, and it creates the fiber of who we are as Americans, right? And so, to get to your point, right? We need to move forward together and lift the boat together.
So we're talking primarily about healthcare in this segment, but we do know that we make promises to veterans, to those who serve. And then obviously when you leave the military, for whatever reason, you've served your time, you're a veteran. And so you are given assurances when you sign up. So healthcare is one, access to maybe retraining, job training, workforce development, obviously home loans, college education, for example. I mean, how are we doing in those departments? I know that's not primary on the list of what concerned veterans are working on right now.
So I am a product of the GI Bill, right? I got out and I fumbled around for a while. I dealt blackjack for a minute. It was awesome until the 2008 crash, right? And then I looked at my life, and I started looking at people on the blackjack table as dollar figures, right? And how much money that they could tip me was their value. And I was like, this is not right. This is not who I am. This is not where, and it's, I know some blackjack dealers, right? And they're amazing people, and they're kind and they're caring, but like that's not what the job was doing for me, you know? So I knew I needed to use my GI Bill benefits. And I went to school, and I ended up getting a master's degree in social work, right? And I worked for the state during COVID as an emergency manager, and I then signed up with Concerned Veterans for America, and being able to give back to my community, right? So talking about education, right? That was my choice, right? Using the GI Bill at TMCC, Truckee Meadows Community College, and using my GI Bill at UNR, that was my choice. I was able, if I wanted to go Western Nevada College, I could have. If I wanted to
come to Great Basin College.
If I wanted to go to Great Basin College, I could have done that, right?
You would have loved it, yes.
I selected the classes, right? If there was a professor that like was whatever, like I'm like, ooh, I want to go to this professor because I understand they, for whatever reason, right? That's who I want to see. The GI Bill was my choice, right? So not to keep spinning a rusty wheel, right? But the GI Bill is a choice for the veterans through accredited colleges. Why can't our healthcare be a choice through accredited institutions that provide healthcare?
That sounds like a really good example, Ryan, that I think anybody listening could understand when you're trying to make these choices about what's best for you and your family, because these benefits also apply to family members for the most part.
Absolutely.
Yes,
yeah. Like
yes.
the GI Bill, the Forever GI Bill, and it's coming under review again to ensure that it's the best program that it can be for veterans empowerment and education, right? I mean, if it's not a right fit for the veteran family, then it's not a right fit for the community, because ultimately that veteran family is not going to be able to strive and become all they can be and achieve their American dream and lift.
And especially families that may be struggling, because we do know the reality of, as you mentioned, suicide awareness, our terrible rates of suicide in Nevada in general, and in the military community especially. So we need to lift those up when it comes to mental health. And I'm glad that you mentioned that you have your master's is in social work, because you do have a deep understanding and appreciation for this kind of struggle, especially when you're in an isolated community.
100%. And talking with folk in Elko, right? Like, excuse me, the beauty of Elko is you are so incredibly resilient, right? You are able to band together as a community and take care of one another. But like any community, right, you're spread out, right? There's a lot of land out here, and there's individuals, right, that might not be plugged in, right? And that's one of the reasons, like, we like Concerned Veterans for America, Concerned Veterans for America Foundation likes partnering and working with groups like Elko Veteran Corps, because that is their mission, right, is to build that community, right? And it's not Elko Veteran Corps giving classes and providing, like, and saying, hey, mental health, let's throw this program and put this and this and that. It's just providing a space for veterans and veteran family members to come together, like the game yesterday. Come together, build relationships, and then if something bad happens to them, they're not feeling great, they have someone they can reach out to. And that's what Concerned Veterans for America is all about, that bottom-up solutions to the issues that we are facing, whether it's policy or individually. It's huge.
Ryan Gerchman is the engagement director for Concerned Veterans for America, which is based now. We have a chapter in Nevada, and Ryan is obviously committed to the outreach that he's doing. We have our Elko Veteran Corps, which we are happy to promote and put people in touch with. And now it's report card time, because as you were talking about this being a federal issue, how are our representatives doing? Senator Catherine Cortez Masto, our Congressman Mark Amodei, obviously any other representatives, but those two are especially plugged into northeastern Nevada.
Absolutely. And so to get back to, we'll work with anyone to do it right? We every time we an individual signs one of our petitions for one of our priority initiatives, they get sent to their elected officials, right? And I sign all the petitions that I'm asking individuals to sign, right? And they get sent to Amadee's office, they get sent to Cortez Masto's, they get sent to Rosen's office, right?
Jackie Rosen, thank
Jackie
you.
Rosen, yes. And I get replies from them all, right? So that's huge. So they are in touch with their constituents, right? I mean, Amadee has an amazing team, and I gotta always shout out to Miss Debbie, who is his veteran liaison, right? And I see her everywhere, right? I see their representatives and their liaisons everywhere, right? We may not agree on a lot of things, right? But we just ask them, and we will still talk to them, and we will inform and try to educate them about the issues that our veterans and our nation are facing, and work with everyone to do right.
So when it comes to the Mission Act, Veterans Access Act, Ryan, do you want folks to reach out at that federal level to the local representatives?
So we have a super easy way for them to get involved, and I should have been mentioning this the entire episode, but our website is C Concerned Veterans V for CV4A.org. So that's CV, the number 4A.org. And they can go on that website. They can sign up as a volunteer. They can take action, right? Based on your zip code. We do need your zip code and your email, because that's how we are going to connect you with your particular legislature, right? Your lawmaker. And you sign that petition. We'll send it to that lawmaker. Even if you're from Utah and you're driving through Elko and you hear this, right, you can sign that petition, because we'll send it to your representative, and they'll know that this is important to you. And if you sign up to volunteer, we're always looking for volunteers to help us advocate for this policy and the community, right? If you're a nurturing person, we need nurturers in our community to bring people together. If you are a policy junkie and you just read and you know everything that's happening, then we need you, right? If you're just looking to hang out and put a smile on people's face in the community, then come on around, because it takes a village, right? It takes a community. I was raised by the village, and that's what Concerned Veterans for America is continually doing, is building those communities, building those villages from the ground up. And that's why I'm in Elko, so I can meet and interact with individuals and identify those leaders that can help us move that dial, move that ball forward for all Americans.
And it sounds like you don't have to be a veteran to be a part of this movement.
You do not, no. We love everyone, right? We'll work with anyone to do right. If you are a veteran, awesome. If you're a veteran family member, even better. If you're a dependent, cool. If you're a patriot, come on, let's go. Let's make a difference.
So again, that website is C as in concerned, V as in veterans, the numeral 4, then the letter A at or .org, just
yes.
.org, yep,
Yes.
CV4A.org,
Yes,
and that
ma'am.
will get you where you need to go. And so just in closing, we have just a couple minutes left, but I'm sure that there's something, if you wanted to come back when our VA cemetery is open, that's something that has been a long time coming. Access to health care, transportation, the mental health, suicide awareness, these are all important local issues that we're aware of anyway, Ryan, and we appreciate you bringing us to our attention this access issue too, with the Mission Act that has already it's already law. So.
The Mission Act is already law, and we're just trying to make it stick and make it better.
Is there anything I didn't ask you about, Ryan? We appreciate, again, your time. This was a road trip for you, but it sounds like you'll be back. But I want to make sure you got to all the things you were hoping to.
I absolutely did. And if I send you an email, right, because I get contacts and people that signed petitions and people that I've interacted with, right, if I send you an email to let you know about the next activity that we're doing, we want to do a gun range shoot day, right? We can provide some ammo, in contact with some great individuals who have some companies in town, right? And provide some food, come out, build some build some community. There's some great restaurants here, right? We go to the Star, we go to Okehana, eat some food, just be a community. So if you have an idea and you want to get together, you can reach out to me. My phone number is 775-531-0688. Always open to chat. You can also go through our website, but give me a call. Let me know what your ideas are to build community. And if you want to become a volunteer, let's work together.
Ryan Gerchman is Engagement Director for this nonprofit organization, Nonpartisan, bringing veterans and their supporters together. Concerned Veterans for America, our guest on Elko Live here today.